Parietal bone is a paired cranial bone. It is present in the vault of the skull and the side of the skull. It is quadrilateral in shape, having four angles and four borders and two surfaces. The surfaces are external surface, which is convex, and the internal surface, which is concave. It has four borders. The superior border is the longest border. It articulates with the parietal bone of the opposite side. A anterior border, also called as frontal border, which articulates with the frontal bone. The posterior border is called as the occipital border. It articulates with the occipital bone. And the inferior is the squamosal border, which articulates with the greater wing of the sphenoid bone, the squamous part of the temporal bone, and the masted part of the temporal bone. The four angles are the antero-superior angle, or also called as frontal angle, antero-inferior angle, or also called as sphenoidal angle, posterior-superior angle, also called as occipital angle, and posterior-inferior angle, also called as masted angle. Among these angles, the anterior-inferior angle is acute. Determination of side can be done by 3 points. The superior border is the longest border. The anterior-inferior angle is acute and the external surface is convex. Therefore, this bone belongs to the right side. Features of the external surface is convex. It has an eminence called as parietal eminence, and it has two lines called as superior temporal line and inferior temporal line. Importance of parietal eminence is maximum transverse diameter of skull is present from one eminence to other. Parietal eminence is the region where the upper end of the posterior ramus of the lateral sulcus is present. This region, the cerebrum will be having the centers of written and printed words. External surface below the temporal line forms the temporal fossa where the origin of temporalis muscle is observed. Features of the internal surface are it is concave. It has grooves for the middle meningeal artery. This is for the anterior division of the middle meningeal artery. This is for the posterior division of the middle meningeal artery. It has a sulcus called a sagittal sulcus near the superior border. And small pits are there for the arachnoid granulations called as granular foveolae. Sagittal sulcus lodges the sagittal sinus. Granular foveolae lodges the arachnoid granulations. Grooves for meningeal artery lodges the anterior and posterior divisions of middle meningeal artery. Anterior border is serrated and it articulates with the posterior border of the frontal bone forming the coronal suture. Posterior border is denticulated and it articulates with the squamous part of the occipital bone forming the lambdoid suture. The superior border is serrated and it articulates with the superior border of the parietal bone of the opposite side forming the sagittal suture. The inferior border is divided into three parts. The anterior part is beveled and it articulates with the greater wing of the sphenoid bone. The intermediate part is also beveled and it articulates with the squamous part of the temporal bone, whereas the posterior part articulates with the masted part of the temporal bone. Anterior-superior angle articulates with the frontal bone and the parietal bone of the opposite side, and the meeting place in between the frontal bone and two parietal bones is called as bregma. Posterior-superior angle articulates with the occipital bone and the parietal bone of the opposite side, and the meeting place in between the parietal bones and the occipital bone is called as lambda. Anterior-inferior angle articulates with the greater wing of the sphenoid bone, and the meeting place in between the frontal bone, parietal bone, and the greater wing of sphenoid bone and temporal bone is called as terion. Posterior-inferior angle articulates with the masted part of the temporal bone, and the meeting place in between the Parietal bone, occipital bone, and the temporal bone is called as asterion. Importance of pterion is the skull is comparatively thinner in this region and it is related with the anterior division of middle meningeal artery. Another importance of the pterion region is the lateral sulcus of the cerebrum divides into three rami and the Broca's speech area is located here. Importance of asterion is the transverse sinus ends and starts as the sigmoid sinus in this region. In the neonatal skull, the bregma and lambda region are not completely ossified and remain membranous. They are called as anterior fontanelle and posterior fontanelle respectively. Anterior fontanelle gets ossified at 1.5 year of age and the posterior fontanelle gets ossified at 1 year of age. Pterion and asterion region also remains membranous and are called as sphenoidal fontanelle and mastoid fontanelle respectively. Sphenoidal fontanelle ossifies in the third month and the mastoid fontanelle ossifies in 1 year of age. Regarding applied anatomy, anterior fontanelle bulges in cases of hydrocephalus condition where there is a raise in intracranial pressure. Anterior fontanelle gets depressed in cases of dehydration. Fractures of the pterion region leads to hemorrhage from the middle meningeal artery leading to epidural hematoma.